My name is Neeta Joshi. I'm going to be your moderator for this afternoon, and I hope you're all really safe and healthy. So first off, welcome to Mashreq Bank and Frost Sullivan's webinar on market impact of COVID-19 on the healthcare industry, preparing for the post-COVID world. Before we commence, I'd like to go over a few notes for this particular meeting. Since we will be presenting really detailed slides, it will be well advised for you to view it in your full screen mode. I'd also encourage all of you to keep your videos on for the duration of this discussion. Also, at the end of the session, we will be having a Q&A and a roundtable discussion after this presentation. So you can submit any questions that you have throughout the session in the chat box that you can see at the bottom end of your screen. We'll try and take most of the questions to the best we can, but in the event that we cannot, please do not worry. We will be in touch with you over email, and we'll take that. Okay, moving on, I'd now like to invite Kareem Amir, Senior VP and Sector Head, Healthcare and Education at Mashreq Bank, to say a few words. Welcome, Kareem.
Hi, thank you, Neeta. And I'd like to welcome everybody and thank you very much for making the time. And we are very pleased to have such an esteemed set of panelists all on the same platform. Just a brief introduction for those whom I did not meet personally. My name is Kareem Amir. I head the healthcare function within corporate investment banking for Mashreq Bank. I've been at this position for 2 years now. We have started the partnership with Frost Sullivan as the first knowledge partnership in the healthcare space in the region towards late 2019 in December, with the first event under the umbrella of the partnership labeled the GCC 2020 predictions, the future of healthcare in the GCC. And little had we known at the time, of course, that we would be hit by such an unprecedented situation just a couple of months later. And this is the second event in the series under the umbrella of the partnership, and the first virtual one. Obviously because of the situation. And the aim is basically to shed some light and insights on the effect of the situation on healthcare, healthcare being at the very center of it. Obviously nothing is unaffected, but healthcare holds a special position, particularly in this crisis, and to shed some light on the opportunities and challenges going forward after hopefully the situation starts improving as well. So yeah, thank you very much. We are very pleased to have you and looking forward to a very good session, inshallah.
Thank you, Kareem. Thank you. Okay, moving on, we at Frost & Sullivan are really passionate about growth, and we understand that corporate growth can be very challenging, especially given the disruptions today. And the COVID-19 pandemic has really overwhelmed all, regardless of the industry, geography, function. And so our team of experts from the transformational health practice, led by Ms. Renita Das, have been really working overtime with the undivided focus on leveraging key growth opportunities in the healthcare space. So today, Renita, who will be our presenter, she will share critical insights, guidance, and direction to help your organizations rebound, recover, and come out stronger than ever before. So before I hand the baton over to Renita, introducing her, Renita is a partner and senior vice president for Frost & Sullivan's transformational healthcare practice. Renita is a healthcare futurist, strategist, and passionate about changing the healthcare industry. She recently got voted for the top 100 women in the film tech and the health tech industry. She's lived and worked in over 10 countries, focusing mainly on healthcare issues and working with public and private sector firms to implement key growth change strategies. She's also an entrepreneur in residence for Wanzo's partners and works on helping to get new technologies to the market. In her current role, Renita is focused heavily on rethinking the consumer business models as healthcare makes a transition to health and identifying opportunities with companies outside of healthcare to bring solutions to this sector. She's also heavily focusing on showcasing femtech and the growth opportunities from this sector. So without any further ado, I'd like to hand over to Renita. Welcome, Renita, and over to you.
Thank you so much, Neeta. Can everyone hear me? If you can just give me a thumbs up, that would be great. Great. Thank you so much, Mashreq Bank, for giving me this opportunity to speak. I really am honored to be here, to be participating in this, and especially in these very, very difficult and challenging times. We have been in lockdown since, I would say, March, and I'm sure so have you. So we're really looking at a new way of life and a new normal. I think for the healthcare industry, if I look at it, COVID-19 has changed healthcare forever, in my view, and healthcare will never, never be the same. In a way, I see COVID-19 almost as a war, but unlike a regular war, it is formless, it is shapeless, and it makes it so much more difficult to fight. And as the healthcare industry strengthens its scientific arsenal in terms of vaccines and medications to win this battle, it also highlights some very, very important salient points that voices like ourselves and providers and payers and manufacturers in the industry really need to think about very carefully. First of all, we already know that the healthcare industry is not equipped or incapable to deal with any form of emergency and adversity. That is very, very clear. Second of all, I think we have also learned for sure that companies outside of healthcare need to help and come in and support this industry in terms of transforming the digital aspects that is so lacking and making change. It also brings to light the glaring revelation that without digital transformation and building a connected society and a connected healthcare system, our future will continue to remain bleak. In my view, it has brought an earth-shaking crisis of this nature to show the need for telehealth. Telehealth has been around for almost a decade, and we have been talking about telehealth from almost 2009. I remember my first conference in this area. And today, till now, even though it's been a decade, most healthcare systems across the world has paid lip service to it. One of the things I do in Frost & Sullivan is I make predictions across the world on all different aspects of what we would expect to see 5 years, 10 years along the way. And one of the big things I remember talking about in 2005 was that by 2015, we would see home testing and home monitoring becoming a reality. And that was in 2005. And I think that reality has come to being as a result of COVID-19. The other thing we talked about is that the home would become the future. And we're really putting the foundation steps in making that happen in many countries of the world. And last of all, I think one of the things that we will see really spearheading this crisis will be that healthcare will eventually become a measurement-based business with the development of analytics, population health management, and obviously AI. So COVID-19 has brought many of these things that I'm talking about to light. And I can be very forthright in making this powerful statement that virtual tools like telehealth, remote patient monitoring, and wearable technology will become a way of life for most people across the world. And it will replace some level of in-person care. And I'm not saying it's going to be 100% replacement. I'm sure it's going to be starting with 10 or 20% replacement and going up. But it has to be as the new normal. Stanford Hospital, which is just down the road to where I live, I was talking to them yesterday, and they said they see around 1,000 patients per week, usually in normal times before COVID-19. And what they said now is they're seeing 5,000 patients in terms of telehealth visits per day. This is one location in San Francisco, Stanford Hospital. So it just shows the need and demand for virtual care is becoming more and more important. So in today's presentation, I will cover a couple of important things. I will give you an economic view of what's happening in the industry. I will then look at some of the predictions and compare what we see GCC countries versus global. Then I will go into each of our industries and look at what the impact of COVID-19 has been on this industry, as well as what are some of the growth opportunities. So I will focus largely today on hospitals and digital health because of time that we have. So one of the big things we do in Frost & Sullivan is we regularly poll our customers, clients across the world. And this is a result of a polling exercise we did with CXOs and what are the top of mind issues for them in your country, in the GCC region. So the results actually reflect some of the answers we got. So we got the 7 big things that most companies, CXO level people, are really, really focused on right now, and they're really concerned about. The first is cash and liquidity. We found 60% of the clients of a sample of around 1,000 that said that they were really, really concerned about cash. Diminishing sales pipelines was around 50% of clients said that was important. Disrupted supply chains was 90%. So this is like a really big issue for the region, specifically because of production and manufacturing. Domestic manufacturing was about 30%. Revisiting established business models was about 70%, so very, very high. And increasing customer engagement models was a little lower, it was 35%. And the need to reset, rejuvenate, and rebound was 95%. So every single person was looking at how do I make that happen. And so this is a sample of, this is a global study that we've done, but these are results from the region. And I wanted to share this with you so that you have an idea of what companies across the world are thinking and believing about this COVID-19 issue. Okay, so as Nita mentioned, Frost & Sullivan is fanatical about growth, and we have been studying growth for the last 57 years. And in that period of 5 decades of studying growth, we have realized that there are 8 important things that have an impact in terms of positive or negative pressures on growth. And we call that the strategic imperative 8. And one of the most important things in this diagram that you can see is geopolitical chaos. And geopolitical chaos is what we call the pandemic today. But there are other issues that also have a negative or positive pressure on growth. And these are some of them: the competitive intensity, internal challenges, mega trends. We've talked a lot about that. The compression of the customer value chain, business models, industry convergence, and of course, disruptive technology, which can have both a positive and negative pressure. So with this in mind, I want to be able to talk about today what has been the impact of COVID-19 on different industries, and then how do we see growth happen, and where are the key growth opportunities? So as you probably know, we have a fairly large economics department within Frost & Sullivan, and their main job is to do forecasts of how the recovery will take place, and all our clients very eagerly wait for that to share the results of that. So this is an updated forecast. We update it almost every week in terms of changes happening. So this is as of, I think as of last week. We have found primarily that Asia Pacific and China will be the fastest in terms of recovery. So we have 2 lines here. The gold line is telling us that if it becomes a global emergency, and the black line if it's a pandemic. Our assumption is that in most countries of the world, it's going to be a pandemic and stay at that way. China and Asia Pacific is already into recovery by Q2, which is this quarter, 2020. By the end of Q4, they will be back to normal and in the green again. The US has a much longer road to go. The US recovery, we are looking at only early next year. It's all in a V shape most of the time. The reason the US and Europe has a much longer recovery compared to Asia is that we haven't had the experience of pandemics, whereas Asia has had the experience of H1N1 and other pandemics that has affected this part of the region. Now, in the Middle East, we're looking at a U-shaped recovery. And the reason you might say is, why is the Middle East looking at a U-shaped recovery? I think there's a couple of reasons. I think first of all, there's been a crash in the oil prices, and we can see that that will definitely have an impact on the recovery. Second of all, I think the coronavirus has really exposed the weaknesses in quasi-monopolistic structures in vital industries, like, for example, retail, supermarkets, food delivery, healthcare, where profit is potentially prioritized over public interest. And this has helped to kind of slow down the recovery. And also, I think the other thing is that we were looking at some stats and numbers, and we found that the Institute of International Finance has already slashed Saudi Arabia's non-oil growth sector growth to around 1.4% this year compared to about 3% last year. And with the increase in VAT that was raised a few days back, there's a limited spending of consumers in terms of GDP. So these are some of the reasons why we expect that there will be a slower recovery, and we'll only begin to see some change and movement by the end of this year going into early next year. So one of the big things we do at Frost & Sullivan is helping clients reset their forecast, their own sales forecast. And actually, to tell you the truth, myself and my team of 200 analysts across the world have been doing this for the last 1 month nonstop for companies across the world, because the biggest issue is how do we reset our projections and then be able to match our bottom line to it. So I'm really excited to share with you these numbers. These are for your region. We have them broken out by each of the countries in the GCC. Obviously, for the purpose of this presentation, we are sharing it on a total level. So I'm going to spend a few minutes on this particular slide. So please bear with me. I hope you can see the numbers in full screen. So the first line, which is the original number in blue, is for 2019 is what the number we predicted, and these are in billions. The second line in 2020 in the first leg is pre-COVID, and then we have two forecasts for you, one in orange and one in gray, talking about conservative and aspirational. And then we have the 2021, which is our assessment of the size of the market post-COVID. So I think the number that we really need to look at is 2021. So if we look at hospital revenues in the region, we're looking at the numbers eventually getting back to 2019 in 2021. So we're looking at about $12.3 billion in 2019, getting back to around the same number in 2021. But seeing a huge dip, it could be anything between a negative 6.4 or a negative 9.2, depending on how the crisis is handled. The third box, which is colored as in red, is really the gold star here. It is digital health, which will be the fastest to transform and recover and with the fastest growth. We're looking at this market recovering to around 10% next year. Just to give you a comparison, the digital health market today in the US is growing at 66%, and we're expecting it to be about 100% growth by the end of this year, just for the US. And we have numbers for each of the countries. The market that is going to rebound the slowest is going to be medical imaging. And I think the reason for that being that a lot of the procedures are not happening. There's been a huge delay in these procedures. And because of that reason, we feel that the imaging industry, the large, big Goliaths in this business, Philips, Siemens, are really rethinking, and we're working very closely with them in redoing their forecasts. So this is an industry that's going to be overall hit pretty badly. I think the medical technology industry will rebound pretty fast as well and get back to a 3% growth. So these are overall numbers that I'm happy to have discussions later in detail. Our team is also, some of our members on this call as well, who have worked on these forecasts, and they can provide you more information. So one of the things I talked about is how do we compare in the GCC region with the rest of the world, and what are some of the areas we've done really well in terms of 5 stars, and what have we not done so well that we really need to focus on. And we took 5 different measurements to be able to do that, and we've done this exercise with most countries in the world, and I thought I would share this. That might be good for to look at the data. So if we look at the first one, which is critical care resources, I think the biggest area in critical care resources is the hospital beds. And I think this is an area that GCC has done pretty well. It has a medium negative impact on the market compared to a really high impact in US and Europe. And I think one of the reasons for this is that there is a lot of ICU beds in rural areas, and the penetration is pretty good compared to the US, where only 1% of ICU beds are in rural areas, and the reach to population is very, very hard. I think the other area that GCC has done really well is ventilators. The US has really struggled with it because US only has an installed base of 80,000 ventilators that they used during this time, and their need was almost 500,000. So it was almost double of what they needed. Whereas in GCC countries, we feel that there is a huge availability of ventilators, and this is not a big challenge or an issue. And besides, there's a lot of local manufacturing in the domestic markets, like in Saudi Arabia. The Ministry of and Mineral Resources has set up a local government procurement authority that has shortlisted almost 50 factories to produce ventilators, almost 1,000 ventilators per week. From this quarter onwards. So there's a lot of positive steps that this region is doing to try to meet the gaps in ventilator utilization. I think the other big area that the region has done really well is in terms of testing. I think that's been, as we know, that's been a very, very critical aspect of success and maintaining the plateau. And I think this region has done extremely well. For example, in the UAE, there is about 121,000 tests have been conducted per million population. In Bahrain, we're looking at numbers of 111 per million population. And if we compare that to other parts of the world, we're talking about 28,000 tests per million in UK. So it's really miserable, and the US, of course, is even worse. So I think in terms of testing, the region has done extremely well. I also believe that the National Unified Procurement Company of Saudi Arabia has tied up with China's Beijing Genome Project to try to conduct about 80,000 tests a day. And I think the China's Beijing Genome Project will also support a lot of the technicians and 6 laboratories that are doing this that can help to further along testing. So the areas that we in the GCC have not done that well has been in supply chain and managing patients outside the hospital. I think supply chain has been an area that has been very negatively impacted by COVID-19 on the healthcare industry. The reason largely being that about 90% of medical devices and 70% of pharma solutions are really imported from outside the country. And because of lockdown measures and isolation measures, it has really disrupted the entire supply chain for essential medical equipment. And I think, this is one area that this region needs to really revisit in terms of procurement trends in the future. And then the last area is the hospital management, managing the patient outside the hospital. And I think this area too is an area that there needs to be a lot more growth and development of building the infrastructure outside the hospital and not having the entire burden on hospitals to treat patients across all countries compared to other regions. So with this, I'd like to go into 2 segments. I think we're halfway there in terms of time, but I want to be cognizant of the fact that we have a lot of things to cover. So I'd rather have discussions and conversations. So I'm going to focus on 2 big segments today, the healthcare segment, as well as the hospital segment, and then the digital health segment. So the first big thing we talk about is what is the COVID-19 impact on the hospital industry in GCC countries. We have come up with obviously a few big impact zones. We've taken some of the most common and most important to share this with you. So I think the first big one is we have seen a huge cash flow strain and liquidity in private hospitals. And one of the comments that a private hospital in the UAE recently made to me was, our outpatient consultations have seen a 70% decline, and our cash paying patients have dropped to 0. And this statement really reflected very truly, because it just shows, the state of the industry in terms of really reaching rock bottom. So what is some of the big things that we are seeing? Obviously, both UAE and KSA have seen a decline of 40 to 50% in terms of outpatient visits this year. And I think a lot of this is going to change if we start building aggressive virtual visit programs. A lot of the high margin surgeries, orthopedic surgeries and other surgeries which are high cost, has been obviously delayed, and that has caused a huge liquidity crisis for private hospitals. Also, we've seen a lot of decline in ambulatory care, largely because people are not wanting to go to hospitals, and that has also caused cash flow issues. The second big thing is obviously we really know for a fact across the world, as well as in GCC countries, that we are not infection clear in terms of dealing with pandemics. The risk of catching hospital-acquired infections are extremely high in normal circumstances. In terms of pandemics, this has not even, we can't even think about it. Today, we have 40 to 50% of our workforce, our healthcare workers in hospitals who are acquiring infections. Nurses and doctors are the highest in terms of this. And we don't have enough policies and systems in place to be able to deal with this. I think the third big thing that we are seeing is that most countries in GCC follow what we call a one-size-fits-all model. Now, what that really means is that every patient is treated the same way, and that is being treated by one institution, which is the hospital. And that, I think, has clearly shown that that's not the best way to deal with it. And we really need to look at averting every patient into the hospital and trying to look at other forms of care and building that home care structure, the non-hospital infrastructure around the continuum of care, and strengthening community-based care. And I think this is going to have a long-term impact if this region doesn't start building that infrastructure around it. And obviously, the last aspect that we see is that there's been a 60% decline in patient volume and visits, just in the UAE specifically because of isolation measures, and that because of lack of patient flow that has impacted hospital revenues. So these are some of the big things that we look at from a hospital perspective in terms of impact. So what are some of the big growth opportunities that we need to rethink as we rejuvenate ourselves out of this crisis? And I think it's a very exciting time for us because I think the opportunities are huge to really change the way we think, and the traditional models of care are not going to work. Obviously, the biggest one that I would talk about is the whole aspect of virtual care, and starting from building the virtual care front door to building remote patient monitoring solutions to building wearables that could be areas of huge growth opportunity. One of the surveys we did in the GCC region revealed, of course, that 60 to 80% of hospitals do not have telehealth platforms for their patient population. And I mean this, and as a result, their conditions are going to get worse if they're at home, and especially if you're talking about chronic conditions, patients who are non-COVID but who have serious chronic disease conditions. How are they going to be dealt with in the future? And therefore, I think virtual visits and virtual care will help some of that, and we need to build that as part of the whole aspect of building smart cities and connected hospitals. I think the second big aspect is building the hub and spoke model, building the hub being the hospital and the spoke being facilities around it, whether it's geriatric care, whether it's mental health, whether it's mother and child care, whether it's just primary care. All of that there's huge opportunities to do that. And I think the home care market is very, very underdeveloped. The third area that I see that there's a huge potential is obviously in the whole aspect of artificial intelligence, cloud, and robotics. And I just think that, we have seen the impact of AI on the medical imaging industry. 98% of imaging that has been read using AI is far more accurate than a radiologist looking at it. And I think we need to start incorporating some level of AI into hospital diagnostics, into actual procedures, as well as into chronic disease management, because we're seeing the success of it. Obviously, a lot of work needs to be done in building health records, etc. But I think there's a lot of sophistication in GCC markets regarding that. And I think the last big area is obviously looking at supply chains and looking at how one can look at more digitizing supply chains and looking at manufacturing more on demand and small size, just in time compared to traditional areas. So with that, I'm going to look at the digital health industry, which is really the gold industry today for COVID-19, as you can see with the forecast, we're looking at this industry traditionally would have grown by 20% this year. Because of COVID-19, it's still growing around 7%, 4 to 7%. And by next year, it'll have grown by 10%. So this is where money needs to go. We did some projections in terms of virtual visits and how we expect the future to be, and we are expecting that for this region, virtual visits will increase by around 4 times over the next 3 quarters. But I think there are some challenges that we are facing. I think the first big challenge is the digital infrastructure, the framework, and the policies which is actually delaying scalability. And I think this is a very important thing is in building that. And recently I started working with some countries developing emerging markets to build some of these digital infrastructures because it's so important as a long-term strategy. I think the second big thing that we're looking at is that telehealth will definitely have a huge impact in the region, and more visits could be done and save a lot of time, both in the time for the consumer as well as time for the doctor by doing telehealth consultations on a regular basis. I think cyber security was one of the big things that the region was hit in the past, and that kind of delayed the whole process of creating the telehealth infrastructure. But we really need to revisit this again and look at how we can reduce the number of attacks. And this is happening every single day in the US as well. So it's nothing different. I think we just have to set frameworks and policies in place and implement them. And I think the last area is, being able to reach patients and understand their needs and be able to serve them better in a anytime, any place care structure. So I'll quickly go through. I think there are 3 big areas that we're looking at, as I talked about. One is looking at digital health policies and frameworks, setting up remote patient monitoring platforms and wearables. And I think I do want to talk about before I leave is mental health. I think this crisis has really exposed the importance of mental health and behavioral health, and it needs to be included in annual checkups and visits rather than just limiting it to when there is an emergency or when there is a problem. And I think unless this is addressed by governments, it's going to get more and more serious. So I think these are the big areas in terms of growth opportunities. Though, I put down about 5 big issues in the way we help our clients. Obviously, risk mitigation planning, revising growth forecasts that we talked about earlier, focusing on growth pipeline and where the growth opportunities are, M&A and identifying companies. We're doing a lot of work in the area of AI for that, and then basically developing a digital strategy for growth. So with this, I'm going to take a pause and take any questions. Happy to discuss anything further in this call or later. My information is here, so happy to connect with you. Thank you so much, everyone, and I'll be happy to take questions.
Thank you very much, Renita. That was really insightful. Sorry, I had to interject in between, but
no, thank you, Nita.
Thank you. Yeah, so I can't see any questions in the Q&A tab, so in the chat box. So perhaps if any of you have any questions, you can see Renita's email there on your screen. So feel free to write in directly to her or to Vivek, etc. I'd like to begin with our panel discussion, and to do that, our moderator for the panel is Vivek Shukla. Most of you already know him. So over to you, Vivek, for the panel.
Thank you, Nita. Thank you so much. And thank you, Renita, for the presentation. Really insightful and well-structured, and gives a lot of insight into where we are headed. And the panel is headed also towards healthcare post-COVID. And we have very esteemed and senior people from the industry today with us. It's really a privilege to have all of you here. We have Dr. Azad Mopin, who's the Chairman and Managing Director of Aster DM Healthcare. We have Dr. Raza Siddiqui, who's the CEO of Arabian Healthcare Group. Dr. Fatih is the Chief Operating Officer of Fak University Hospital. Dr. Ibtisam heads the investment and PPP in Dubai Health Authority. Dr. Mohaiman is the CEO of Al Zahra Dubai, and Dr. Iham is the CEO and founder of Acumed. So we have healthcare providers, and we have one person from the revenue cycle side, because, as Vanita said, liquidity and cash is going to be very, very crucial. Okay, so I will start the panel with my opening question to Dr. Azad. Doctor, we know that you have been here for a very long time and you've seen healthcare evolving in this region for last almost 3 decades and more. Do you think there are some changes that have happened with this recent pandemic? And do you think there are some changes which are like irreversible changes? And are there some things which have changed for good? And are there some things which have changed forever? And if yes, what?
Thank you. Thank you very much, Vivek, for that opportunity. And thanks, Ms. Das, for the excellent presentation. We really appreciate the view coming from US. If you look at this region, it has been very, robust in dealing with this, even though it's a new experience and it's a very young country when you look at healthcare, because the healthcare as such, if you look at it, is only 50 years old here, whereas in other countries, it will be much more older. And it has taken it very well, if you look at UAE or the GCC as a whole. But one thing, as we are looking at what is that has come out and how you are looking forward. So one of the important things that is going to happen here is that digital transformation. So our CTO was telling that according to him, the COVID has been the most potent digital transformation tool rather than the CTO himself. So that he was actually shooting himself on the foot, but telling that, which is true. So we all realize that, like Ms. Das said, for many years we were all professing, saying the importance of digital transformation, telehealth and all, but nothing was happening. Suddenly people now get up and you see large number of teleconsultations happening, telemedicine gaining, and that is something which is going to stay. So answering your question, Vivek, one of the very important areas will be that digital transformation. So that is one of the important things. Then you also will see that there is a difference in the way in which the business look or the management looks at the requirement for people, at least in the area of non-medical area. That is a back office work, administration work. We have now in the last 2 months, we're working from home. And this has become a new way of life. And we realize that many things can be done from home rather than being done at the office.
Yes.
So this has given the insight that if it can be done from home, why can't it be done from a country where it could be much more economical and done more efficiently? So one of the things which is going to change definitely is going to be the offshoring business, where people will be looking at ways in which this can be done in other countries at 1/5 of the cost that we are incurring here. That will be a transformation, and that is going to be a major change according to me. And the third thing which I want to tell is the digital transformation, especially in the KPO area, the knowledge process outsourcing. Apart from the what is happening from the side of the demand by the customers, in the backside also we can improve our efficiency if we start doing the knowledge process outsourcing. One of the things which we are trying right now is to look at ICU monitoring from a country where the cost is much less when compared to what you spend here. So if you have a large requirement, which we have now, we have largest number of people on ventilators and the ICUs are full and we are trying to add on facility. So in that situation, isn't it possible that a large part of this can be actually monitored from a third country where there is more of availability of skilled manpower as well as it much more economical? So this is exactly what is happening now. We are now in discussion with the DHA to get an approval for at least managing some of these cases, taking the rounds in the ICU, as well as doing many of the things usually being done by doctors here back home. ICU, telemonitoring of the ICU by the doctors as well as by the nurses, and having minimal staff being deployed physically here. So these are few things which I just wanted to tell because of the want of time. I am not going into everything, but basically it is digital transformation. And one of the most important things, which is as a whole, it's going to happen to the industry. The last thing I want to tell is that there will be, apart from whatever we think, there will be a diminution in the demand side. Because in the last 2-3 months, people have realized that with treatment, cold takes 1 week. Without treatment, it takes 7 days to disappear. So people have realized that, like my professor used to say that he's a very pity person. He used to say about obstetrics gynecology that deliveries are supposed to happen at home. That is how God has created it. And there is no requirement for anybody. It will happen. But you in between interfere and make a living. So that's why there are large number of obstetricians and gynecologists. So this people are realizing. And there will be a demand side decrease, because I don't think more people are dying, more bad things are happening because we were out of hospitals or out of clinics for the last 2 months. So I have a feeling that there will be a diminution in the demand side also, which will have an impact on the overall business. That's all. Thank you, Vivek, for the opportunity.
Thank you, Dr. Azad. So very important opening points. I think 2 or 3 things which I will open it to the other panel members as well. One is technology. The other is some bit of manpower, which can probably work from home or work from remote locations. And then there is things about diminishing demand, which might result in diminishing overall business. So Dr. Ibtisam, coming to you next. As Dr. Azad said, telemedicine and technology. So from 2 things from Dubai Health Authority side. One is, of course, there's a great, wonderful job being done on managing the pandemic and how the situation is being taken care of in the UAE. So a few words on that. And then does the focus of investments and PPP, does it change towards technology? Does it change towards new things post-COVID? So 2 questions for you.
Thank you, Vivek, for bringing me on board for such discussions, and I'm really glad to see all of my colleagues. It's been a while, we were away in terms of meeting together, so we are basically now meeting on a digital kind of a tool. So the thing, it's like I've been in this position for past 3 years, and we were looking at the Dubai as an investment hub, and there were so many plans coming in, but because of the COVID-19, the plan has changed, things has paused. But what we are seeing, honestly speaking, it's a great opportunity for other services to be pitched in the healthcare sector. As a UAE country and Dubai as well, we have done tremendous job, honestly speaking, comparing to any other GCC country as well as the other countries in the world. We have done a massive screening test. I think it was something, even drive-through, which nobody can imagine how many of those has been done in our country. The other things, we have done a beautiful field hospitals across UAE. If you go to Abu Dhabi, or you go to Dubai, you will see a beautiful setup which has been done. Not only just seeing the green kind of a cases. I'm being a physician, not just taking care of the mild case, but however it's a mild to moderate to orange cases who require oxygen support were being given to them in the field hospitals. I've seen that in Abu Dhabi, and Dubai is implementing the same. And of course, why we had a good ICU setup, because we were oversupply, honestly speaking, for past couple of years. And this has been beneficial to the country because we had hospitals coming in the loops and coming in, and using those facilities had helped during the pandemic. The government has set up a great budget from the central bank for supporting pandemic in this situation. I know there is some issues in cash flow and rejections in terms of the funding, but however, there was a mandate coming that most of the services needs to be given to the people who are positive of the COVID-19. And despite what kind of sector is providing the services, whether a public and the private sector, but however, yes, I agree, there should be a more support in terms of the policy to build up the whole infrastructure. let me tell you this. We, as an investment department, we were working on the policy for the telehealth, and that was a great opportunity. And we never expected that COVID-19 is going to come in. We had some kind of companies available, and they had the platform over here, but there was some kind of restriction from the TRA, but which is the telecommunication, but this has been eased up during the COVID-19. And honestly speaking, economy and healthcare sector, they both are geared together. And I feel as well that you know, the COVID-19 will boost the healthcare technology services. And if you want to talk about technology services, not just telehealth, where you have a counseling and building rapport and looking after your chronic cases and COVID-19, it's basically as well, you need to think what other AI solution you need to put in your hospital, not to take the place of the physician. It's basically to finalize their decisions, as well as to help them and support them from the tool perspective. So that's will create a lean in terms of your operation, bringing the pull-in system rather than push-out system, and to maximize using the times and to bringing the services to the patient as soon as possible. The third point, the telehealth or the technology can help the healthcare system. It's basically the research, which no one has touched. Having kind of like a supercomputers, bringing the evidence together to mandate and to bring the solution for the treatment, as well as for the vaccinations, will be a great tool and help the scientists as well as the physicians for such a sector. Now, you asked me about PPP. I know you're running out of the time, and I have a lot to say, but let me summarize this into 2 to 3 sentences. PPP law is intact in Dubai, and we are going with our projects. Honestly speaking, despite the situation we are in, recently I have a meeting with His Highness, and we proved our PPP projects is going to go live soon. So therefore, it will be 100 beds PPP services for the cardiology and other services as well coming from the PPP perspective. If you look at it from the management contracts or operational contracts or other kind of tools that you use for your PPP projects. So that's for me at the moment.
Excellent. That's very heartening to hear, Dr. Eptesam. And there's something very pertinent you mentioned. You mentioned a phrase called lean systems for healthcare. So that takes me, to Dr. Raza and Dr. Fatih, and even maybe Dr. Mohammed on this. And then eventually I'll come to Dr. Ihem on the cash flow issues. So on the lean side, we all know that to have a lean hospital, half of our costs is manpower cost, right? So, and then it doesn't really, it's almost inhuman at this time to reduce the manpower cost or reduce salaries. What are some of the ways in which we can create lean structures? Could it be supply chain disruption? I mean, having a new vendor system in place, or is it something else? Is it something to do with the overall operational efficiencies, getting your operational flows, re-engineering them, putting something which is right now in the front end, putting it in the back end, as Dr. Azad said, people can work remotely. What are some of the ideas which we could have post-COVID? I leave it open to all three of you, whoever wants to take that, for cost efficiencies, for optimizing cost, for creating a lean healthcare organization.
Thank you very much, Dr. Ranita, for a beautiful presentation. Thank you very much, Dr. Eptesam. Thank you very much, Dr. Azad. It is a pleasure to be part of this young country and young healthcare system. And I've been little junior to Dr. Azad, but I've been here for now 22 years. And I have been part of the healthcare system here. And I'm really proud to see such a young healthcare system dealing so professionally, so aggressively with a pandemic like this. I don't think we have many examples in the world where countries can compare with the approach UAE has taken. I will give you a simple example of the preparedness of this country. I was talking to some of the officers of Abu Dhabi 3 months ago, and they were buying chloroquine. When India the base manufacturer was not even thinking of chloroquine. So I got an inquiry from Abu Dhabi to talk to some Indian manufacturers to buy 2 million chloroquine tablets. And Indian manufacturers were not prepared that time. They said, but you have to give us 2 weeks time, then only we'll manufacture. This is an example of the foresight of the rulers of this country and the preparedness they were having, preempting the situation. Now, healthcare system is young in this country. I always talk of ecosystem, and then only efficiencies can come. Like, for example, in this country, we were practically arm-twisted, blackmailed to sort of for getting PPE at a good price. So I always feel that as ecosystem, we have to work together and have manufacturing, have to have pharmaceutical, all these industries working together with healthcare providers to bring in cost efficiencies. Because in healthcare, you have two major costs. One is manpower cost, other is material cost. Manpower cost, you have very, very little margin. In these circumstances, when the morale of the manpower, which is fighting day in and day out, is challenged, how can you cut costs there? That is a very, very big challenge. Material cost, we are basically importing most of the things from outside. So that is the area we have to look at. And then comes the third area, management. And management efficiencies, of course, Renita has explained beautifully, and Dr. Ibtisam has mentioned it. We have to go for AI, we have to go for robotics, and these are the telemedicine, which is going to happen. Now, if we had robust telemedicine system, the private healthcare system would have not suffered that much, because 60 to 70% of the revenue of the private healthcare was coming from outpatient visits, which totally stopped during the last 3 months. I have seen myself, Dr. Azad has got a bigger network. There is a drop of more than 70% in outpatient, which contributes 70% of the revenue of the hospital. So that is the area which has to be focused a lot. If remote and telemedicine would structure well, I think we can do much better.
Yeah, so I think the takeaway point is, apart from telemedicine, is about the material cost and having things being, and the whole ecosystem, as you said, coming together rather than individual hospitals fending for themselves. All stakeholders within the industry work together and fight together. Dr. Mohammed, you have anything to add, and Dr. Fatih?
Thank you very much again for having me in this panel. I'm glad I'm here today. And just to add to what was previously mentioned, again, technology plays a great role. And even we look at technology in terms of productivity and lean management of the workforce. I'm talking about the back end as well. So we can have, we're glad we have IHAM with his background in revenue management, wherein yes, hospitals are required to manage revenues as well. And this back end, you incur a huge, I can say, army of people managing it. But you can run this more efficiently, and this helps you with manpower optimization as well. So optimization can happen still at the manpower, not necessarily at the frontliners who are there to serve patients, but your back end, if it is redundant, you can do many things about it, especially utilizing technology and tools that can help optimizing the workflow. We have discovered that many of the things that we have been doing throughout the previous time, it's been done now with people working remotely, working from home as well. So these are areas which we can leverage post-COVID to continue these gains. It's some temporary gain, which we need to look at to continue how to optimize the back end, for example, the revenue cycle.
Yeah.
On the other end, also, we need to consider that if you look at the manpower, and having gone through the demand and decline, which we expect to see, we will also go through some economic downturn due to many geopolitical changes and these liquidity and cash issues. I think we might have an issue with retaining manpower the way it used to be in healthcare, especially the ability to continue to have the better pace compared to other parts of the world for the GCC. So healthcare workers used to be as an expat group who come to the GCC for many reasons, among which is better pay scales. And this can become a challenge in the coming, post-COVID, because with the demand and decline, with this liquidity and cash issues, you might not be in the position to continue doing the same. So this is something that we need to look at, especially with the diminishing healthcare workforce globally. Also, we need to look at the issues that will happen post-COVID, where you will have a group of clinicians, whether doctors, nurses, who have been too much stretched, too much stressed, and they will come out of this with what you call it the post-traumatic stress disorder. They will come very stressed, and there will be also a big impact when you start to need them to start to regain your elective activity. You want to start doing your surgery that has been delayed for a time, where you end up with a very stretched team. So this is something that post-COVID, immediate post-COVID, we need to consider as well, how we'll align and re-energize the workforce, the healthcare workforce, to be able to continue providing the service. And of course, yes, I think technology also will play a major role here, yes, especially for outpatient consultations.
Yes, thank you, Dr. Mohammed. Thank you very much. Very, very, very important indeed to have a balance between the front end and the back end, to have your costs be in control. Dr. Fathi, your thoughts, and just to add one more question to you, since you have patiently waited for this long. So one more question to you, because you are coming up with a new hospital. For greenfield hospitals, how are things going? Not that we are having too many greenfield hospitals coming up, but still, what are some lessons for greenfield hospitals? Do you think there will be changes in the way people will think hospitals from now on, or the way they will build hospitals from now on? And also something on the cost optimization and supply chain, if you can add.
Thank you very much, Vivek. Thanks for having me here. And I would like to just, start with thanking to our government and also our colleagues, what they have done in this COVID management. We're all impressed with the current management. And as FUH, Fakir University Hospital, we are at the last stage of our commissioning, and then we are excited to enter to, service line. And since we couldn't, help at this stage, we just wanted to help to our government by giving a significant portion of our medical equipment to the field hospital to make it ready as quick as possible. And then we have already ordered the new items, and we're going to get them within a couple months' time for us to be able to open. So then we are all excited to work together with our colleagues soon. If we look at the supply chain part, our colleagues have already mentioned lots of things, but I can maybe add just one more issue, since I'm looking after our group's supply chain overall. I can see another important thing is the flexibility within the organization. If we can put this flexibility by moving the material from one area to another, and then managing the people from one area to another, and also changing the purpose of the building with this flexibility, it makes the operation efficient, and we can help to more people. And I can see lots of countries, they were not able to manage this one, and then they have failed. I have visited lots of hospitals in Cairo. If you go to there, you will see some people sitting in their offices. In the office, you will see a bedhead unit just behind them. Why? Because those hospitals in earlier years, it has been managed and planned in a way with this flexibility that you can utilize every single room as a patient room. And if we look at these old hospitals, old people's mindset, they were there. But now we don't have this one. And if you ask me about the greenfield hospital changes, what we will see in coming new hospitals, as the group today, we have one construction going on in Medina, and we have 100 hospitals in Jeddah, and we're just starting the new construction in Mecca. We just acquired a new hospital in Abu Dhabi. So lots of constructions are happening around. So what I see, flexibility in the hospital design is going to be an important point. We have to have flexible HVAC systems, which will allow us to change the purpose of the rooms from the ICU to the normal room, and then the pressure management and the other things. It's going to be very important. Command control centers is going to be very important. As Dr. Azad said, today it is the time to manage lots of patients from one center by using the data, as well as the eICU systems. We will see lots of new applications coming in that we can manage lots of patients, not from, just in one city with multi-sites. From different countries, we can manage lots of patients together and manage the cost as well. Another important thing, what we are seeing now, Vivek, is the isolation of the building itself.
if we look at the old designs, we have built the hospitals on one, core design. In this core design, there was one entrance and then one service at all within this hospital. And we have seen the disadvantage of this now. What happened since the elective services has been stopped. So then we have only one entrance. We only have to, we're able to use this entrance for the COVID patients. If we had two towers, one tower was able to manage the COVID patients, which is now going to decrease the numbers, and the other tower immediately can be utilized, isolated for the other patients. And I'm glad, FUH has this function, and then from now on, we will manage all our hospitals in this front. Another important thing, what we have, observed within this period, ambulatory care within the hospital, diagnostic care within the hospital should have an access to the street. Why? Because people, they don't want to come to the hospital for the ambulatory care and the diagnostic services because of their fear that the hospital has a contamination inside. But if we can give the access to the people that you can have your MRI, CT by not getting into the hospital from outside, the direct access, you can get into the hospital and you can get this service easily, then this will help us. Because the thing what we are seeing now, yesterday we had a long workshop, we are just discussing what is the new waiting room in the hospitals. The waiting room concept is going to change dramatically. Why? Because the portion of the patients from now on will require the telehealth, and then portion will require the physical visits. So then we have to change the waiting room setup from there. Doctors, they may need a video call room instead of just the patient room, the clinic over there. So we are bringing a new setup over there, and we are also discussing this with our technology partners. Just last point, if I may touch, we need another point, which is the online and offline integration. What is this? Today, we have seen that clearly we were not able to help all our patients in our hospital. We tend to manage a portion of our patients in either hotels or at home or in the other areas. Today, we need the online and offline integration together, where we can manage with the same systems in our hospital, within our eICU system, we have to connect with the patient at home. So at the moment we are working with Cisco, and then we are going to have this system in our hospital ready where the similar item can be installed at home, and we can just connect it and we can continue monitoring this. And as Dr. Azad has also touched to the point, the home healthcare is going to be very important. Which we believe there will be more and more services to be extended from the home healthcare arm, and then we will see more investments in this one, and then we have to extend the services to the other areas. Thank you very much.
All right, thank you so much, Dr. Fatih. Thank you for your thoughts. My next question is for Dr. Iham. Thank you so much for waiting patiently. I wanted to ask this because this is a very important question. I already see Dr. Mohammed, sitting straight in his chair to listen to the question and your answer. The answer is about money, right? So it's about cash flows. It's about liquidity. We know healthcare is very unique because the user of your service is not necessarily the one who pays for that service. There's somebody else who pays, and he pays after a gap of a few months or a few weeks. So what are some would you be able to share some best practices or some things which hospitals can do in order to have faster turnarounds, in order to have lesser rejections? Plus, do you also think that insurance companies will be more prompt and faster in settling the claims, or will it be the other way around? So what are your thoughts? How will this pan out? Will the troubles multiply in terms of money and liquidity, or will they be easier? And what are some best practices and things that hospitals can do? I'm sure all the other panelists will be listening to you very keenly on this.
Thank you so much, Mr. Vivek. And I don't consider this waiting at all. I was enjoying everyone's thoughts and ideas. It's really very thoughtful. Healthcare, as you rightly said, we have this complication of the fact that not necessarily the user is the one who's paying. And in reality, actually, not even the one who is paying is actually funding it back from the user, because he's funding it from the employer. So we've got all of this formula within the healthcare that is going to be making things challenging. everybody has seen now a drop in a number of cases. I think while there might be, let's say, a rebound soon, maybe soon after when COVID-19 a little bit clears, on the mid to long term, we are going to see for a period of time less utilization. The less utilization will come from the fact that there are healthcare at the end of the day is part of a full economy. And the other economy parts are also impacted. There are lots of businesses who are going out of business, lots of people being put on unpaid leave or terminated, which means we will see less in people with insurance and less utilization anyway, because some of those people are expat and might actually leave the country. So we have to brace ourselves for that. And on top of it, we're going to see probably less of average of revenue, which we're going to start seeing it right now. So even if I'm seeing this patient, and previously I used to treat this patient with the cost of X, my cost now will be X minus, because most probably that patient has probably had the lower kind of a policy from his insurance company, because his employer is reducing his benefits to save on cost, which means I, as a healthcare provider, would not be able to get all the benefit from it. Now, on top of that as well, cash will be a challenge, because anyway, the user as inpatient is already challenged within his income. And the third point, which has been touched on, is probably patient trust as well, and people whether they want actually to go to hospitals or not within this situation. So having said all of that, we know that there are certain areas which is going to save and help. And it has been mentioned clearly, I don't want to touch again on that. I think digitalization, technology, if we look at digitalization in healthcare, I think there was a study by UBS Bank stating that digitalization in healthcare is very much close to mining industry and agriculture industry. So it's this bad. So there is lots of work that can be done in hospitals to improve on the technology side of it. But then again, you're coming to a CEO and a CFO telling them, I want you to invest better or more in technology at a time when they are seeing their revenue is dropping, at a time when they are seeing also the forecast for the future is a little bit difficult. So I want to focus on revenue, because I think the focus, while, and this by any means does not mean that technology or any other solution is not important, it's all important. But I think if I wanted to give my personal advices, and many of the gentlemen on the panel are much more even expert than me, but if I want to talk about the revenue itself, I think that everybody needs to look at their operating model again, needs to look at their balance sheet again, needs to look at their P&L again. I think cost has to be optimized. There are different ways to optimize cost, but it has to be optimized. Technology is one of them, but there are different ways, some of them mentioned by Dr. Azad, some of them have been mentioned by other guests, but cost has to be there. The other area which we need to look at is we need to reconsider our understanding of how we are delivering the service and what is our partner outside is suffering from. You've mentioned insurance. Insurance is key, and unfortunately the healthcare industry is very much fragmented in this part, where insurance, healthcare providers and healthcare payers are on different sides, kind of, and healthcare providers both, even between each other, are kind of fragmented, let's say. So we need to see better cooperation. We need to look at the insurance side of things to understand what is their pain, what are they going through this time, and how can hospitals build their offering and service around things that will work with the insurance, so we all of us go on win-win situation. To tap on how the insurance is behaving, I can tell you from data we are seeing over the past couple of months, insurance are paying faster, but they are compensating the fact that they have to pay without enough time to process claims by increasing rejection. So me as a hospital, I used maybe to get my money after a few months, and I used to get, let's say, 85% of what I have sent. Now I'm getting it faster, but I'm getting 60%. And I need to deal again with 40% or 30 or 40% in rejections and resubmission and denial management, which is all, again, more burden, financially speaking, on a hospital or on a system that is already burdened with the COVID-19 situation. So I think that we have to figure out ways in order to put the industry back together, and hospitals changing their offering, as I said, to meet their partner, which is the insurance. I think the last point before I move on to one last point, sorry, is about looking at my, again, balance sheet and look at models whereby I'm moving more of my fixed cost kind of to a variable cost. So like Dr. Muhammad said, I might not be able to afford paying the doctors the way I used to pay them before, but I might be able to come back with models which is maybe more lucrative in terms of reducing my pay in certain areas, but increasing percentages for them, getting them to share with me my revenue, partner with me my revenue, with consideration of course of the fact that we have to ensure that there will be no overutilization of services as an outcome of that. But we have to think about different models, how we are managing our fixed costs, and this payroll being a fixed cost into moving it into somehow variable cost. Offshoring is a good example mentioned by Dr. Azad, in a way that I'm moving all that cost out of my balance sheet. I think the final factor I want to add, which I think is an extremely important factor, and I have been working in the GCC sector for the past 16 years, and I think it applies in the GCC in general, and it applies in UAE in particular, is what I call the panic factor. And the panic factor is a very, very, it multiplies the negative impact of any crisis we face, because usually panic gets across all. So you have a panic of a patient going to a hospital, and you have a panic of an investor continuing investing. You have a panic of a user doing anything, and suddenly you find everything stops. I think this panic factor is an area where we really need to try and overcome to ensure that the economy keeps going on. Because again, as I said, I can talk about healthcare and healthcare in revenue as much as you want, but at the end of the day, healthcare is part of a system. To give an example, we talked a lot about digitalization and how important it is. And we have seen incidents whereby hospitals were supposed to implement technologies, certain technologies, and because of COVID-19 that has stopped. Although you could argue that this is the best time to implement those technologies because you're more free in the back office side of things, and you are already be able to utilize the technology to reduce your cost. But still, we've seen panic saying, I don't know what's going to happen. I want to keep my cash in the bank, and I want to continue this. So I think that is a key factor. We have to remember at the end of the day, and sorry for taking more time, we have to remember there will be victims. We have to accept the fact that there will be victims. From my side, at least, we are starting to see victims, especially in the mid-size to smaller size kind of providers. And we have to understand that the healthcare sector will have to shift and change. And I think, as I said, everybody who is running a business and everybody who's running a healthcare facility and looking into the sustainability of it, changes has to happen from now, and it has to take to cater for the fact that this is here to stay. Even if we finish, hopefully, COVID in a few months, the impact of it will go there to stay. Ms. Stats has showed us that we will recover in Q1, hopefully 2022, I think, or Q4 2021. But that recovery is bringing me back. If I look at the graph, that recovery is bringing me back to where I am yesterday, before COVID. I still didn't recover on this of loss of my revenue, which probably might need another 12 months for me to balance my EBITDA and balance my margins. So it is here to for some time to stay, and we need to act on it accordingly going forward.
All right, I got it. Okay, great.
Thank you for the time, and sorry for taking longer.
You're welcome. You're welcome. I think what we can do is to wrap it up, maybe one sentence each, unless somebody has questions, unless someone wants to ask a question, from each other, like if somebody wants to ask a question from another panelist. Unless that's the case, each one of us can, in one sentence,
I just have one insight, if you don't mind, that will take only.
Sure, Dr. Mohammed, sure. Go ahead, please. Go ahead.
So again, it's just to give an insight on healthcare in general, and private healthcare in particular in the GCC. Unlike everyone might think, even those from outside the industry, that healthcare can be flourishing because they have patients now, they are servicing now. Other industries have just closed their doors. Hospitals are full of patients. But on the contrary, this is a huge suffering for the system, because you have to handle patients who are very risky, are very costly to handle, while you are deprived from your elective activity, which is the mainstream of revenue for an organization. So if we are looking at some sort of a support, whether it's a government support, this healthcare should be prioritized in the immediate and short term. In the immediate and mid-term, healthcare support and stimulus package should be prioritized for healthcare in particular, because you need to sustain them for the post-COVID. You need these organizations to continue for the post-COVID era with the level of quality that they have already acquired, and you don't want them to start from scratch. You need to build on what you have gained in the GCC in terms of maturing healthcare in a very short period of time. So
Dr.
my message
is that question for Dr. Ibtisam?
It's a general question.
Or
Not
am I assuming?
Dr.
Okay, all right.
Dr. Sam, actually, she knows these very well, I'm sure.
Yeah, we have discussed this many times and we agree on that. But one thing I need to say to everyone, we are blessed being in UAE, honestly speaking. That's because we have a tremendous collaboration between public and private sector. There's a great trust from the populations to both systems. I know there are issues. There is no perfect system in the world, especially when it's come to healthcare, because we are doctors, we are professionals, and we are talented, and we always disagree in so many things. And that's the reason sometimes you have issues here and there. But honestly speaking, during this disaster, or I call it kind of a crisis management, we have faced different viruses in our life, like SARS, H1N1. I was in the airport as a medical director. I faced it, but it's never happened at the pandemic level. This is the first time what's happened, but we are blessed. We have a great crisis management team in this country, and SEMA did good job, Dubai Police did good job, many stakeholders, including public and private sector from the healthcare system. And I think I agree with all your concerns and all the points has been raised. This will be taken into consideration post-COVID. I know that we need time to recover. We will have a U-shaped kind of an economy, and we know this. This is not first time we are going into crisis. We have been into real estate and financial crisis in 2009 and 10, and we recovered it. And I'm sure our leadership at governments are quite strong enough supporting every single individual in this country. That's my take-off notes before I leave.
Thank you, Dr. Hassan. So to wrap up, I think one sentence each. What's the take-home post-COVID for healthcare? What's the most important thing that you would want to say in one sentence? I think we can start with Dr. Azad. We can probably start in the same sequence as we did earlier. You're on mute, Doctor. I think you will need to unmute.
Sorry about that.
No problem. So what's the one take home, like in one sentence, one message? I think one sentence take home message.
Yeah. So thank you very much. Thanks a lot, Vivek, for that excellent opportunity. We really enjoyed all the panelists coming up with a lot of as well as views. So the one thing which I would like to submit to the panelists as well as the people who are all mostly from the provider side is that there is absolutely no control or very little control on the demand side or what business you are going to have, because we know that it happened now, 70%, 80% decrease in the demand. So what is that under your control? It is the cost. The cost is the most important thing, and cost containment, like we all know, is under our control. So you will have to now look at each line item where cost can be controlled. And that is something which can give you huge benefit, even if the situation is better, normal or worse, you will have that benefit. So please focus on the cost side of it and try to control the cost. And that is my advice to everyone.
Thank you very much, Dr. Azad. Dr. Ibtisam, one last parting note.
Last note, I would say that I think healthcare system post-COVID will change towards technology, and model of practicing of current operations will change. It will be more contained, more sustainable, customer focused, and what customer is required. And I think there will be a lot of PPP projects because government will support the private sector, where you can have new investors coming or invest to encourage the current investment as well. This is what I would I would say.
All right. Okay, got it. Thank you, Dr. Raza.
Thank you very much. I think everything has been covered. One point which has not been covered is building healthy communities. Wellness is the solution. We have seen that people who are suffering and occupying hospital beds for longer period of time are the patients who have comorbidities. So it is the responsibility for all of us, all the healthcare providers, to work and focus on wellness and build healthy communities. And the focus is prevention. That is what I would like to say in the end.
Very, very well thought. Well thought. Dr. Mohammed.
Yes, again, I think Dubai has got a unique position here because they have been exposed to this U-curve before, successfully navigated through it. And I think, I'm sure that this time also, they will successfully navigate through the U-curve because of the unique leadership we have in Dubai, and because of the experience we have in Dubai, the melting point of the whole region. I think we will come up with it. The only thing I need to highlight as a post-COVID era is to put more focus into more potential of having this again in the future. We need to have a good learning from what happened. We have very good platforms of coordination now, but we need to build in future the possibility of handling such a pandemic if it ever happens again. We don't want to come with that. We want to get benefit from the learning that we have.
Yes, yes, absolutely. Dr. Fatih.
Thank you, Vivek. It was a great discussion. Very quickly, I mean, lots of things has been already discussed. I would like to say one thing. COVID has taught us one thing again: there is no competition in healthcare. There is collaboration in healthcare. So we have to collaborate more in coming time after COVID, more and more. And this way we can heal more people and we can help communities in a better way. Thank you.
Well said. Very well said. Dr. Ayman, Dr. Ayhan.
Well, I think a couple points. If I wanted to focus again on the part of revenue in healthcare in particular, without impacting and talking about other areas in healthcare, it would be similar to what Dr. Azad has already mentioned. I think everybody needs to look at the cost right now. They need to be sitting on each item of their balance on what of how.
Yeah.
Sorry, can you hear me?
Yes, we can. Yes, we can.
So, and just look into cost and see how I can optimize that cost, while at the same time making sure that they do not, they retain their current business, they retain their current patients, and look of course for growth, but at least maintain my cost and maintain my patient. This is in healthcare. I think I want to add the final thought, which is probably not very much related to healthcare, but in general, I think the COVID-19 is definitely a negative thing. But if I wanted to take one thing positive, which is I keep talking to people and everybody is very anxious to go back to how life was. And I think maybe let's not go back to how life was. Let's just go move into a better life if we can. There are areas which COVID-19 has showed us that we have weaknesses, and whether it's healthcare, and despite the fact that we have an amazing experience in dealing with it here in UAE, but still we were able to identify now on this panel a few key things which we could probably easily improve on. And that is not healthcare, that relates to all our businesses, even all our personal life. I think I would say let's not go back, but to where we were, but let's move forward to something better after post-COVID-19. Thank you.
All right. Okay. Thank you very much, Dr. Ayhan. Really a privilege and an honor to be here today amongst all of you and have this discussion. Thank you so much. I will hand it over to Nita now for further action.
Thank you so much. Thank you, Vivek. Thank you all the doctors for your insightful talk. I think it was really very insightful, a lot of good key takeaways for us. And thank you, Renita. You've woken up. I know it's like 5 a.m. for you in the morning. So thank you very much for taking the time. And any questions, anything, please reach out to us. We'd be happy to take any questions later as well. So thank you. And bye-bye now. That's it. Thank you.
Thank you so much.
Thank you.